Okay, shall we start?
Yes, please.
Okay, thank you. I'm not able to share my screen.
Yeah, okay. Try again, please.
Yeah, thank you. All right. Are you able to hear me or able to see the screen?
Yes. Yes, ma'am.
Oh, okay.
Yeah.
So let's head to the next tip. So my next step would be to think in a more solution-focused manner and plan ahead of time. Planning ahead of time can reduce that sense of uncertainty and can give you that security. So if you're feeling that things are getting out of hand, or if you're not able to control your anxiety or worry, take a break, make a list of possible solutions to your problems, plan ahead of time. There is no right or wrong answer to this, or basically any plan is certainly better than none. So try to think in a more solution focused manner, which again sort of goes hand in hand with focusing on what is in your control. So moving on. My next and my most important tip would be to get a good night's sleep. Now, a lot of research over the past several years has shown several correlations between lack of sleep and depressive moods and poor attention and problem solving abilities. Now, something that I tell people is that you can't control how well you sleep or for how long you sleep for, but you can control what time you wake up every day. So even if you have not had the best sleep in the night, don't try to extend your sleeping hours. Try to wake up at the same time every day. This might be painful for a few days, but if you wake up at the same time and have a routine sleep, your sleep will adapt naturally over time. It also helps to follow nighttime rituals like exercising in the mornings, keeping your day busy with a mix of physical and mental activities, refraining from looking at any sort of blue light from technology, from phones, at least 2 hours before going to bed. Having a nighttime ritual like having chamomile tea or hot haldi milk, or taking a warm shower, and having no caffeine or any sort of tea after noon. So following sleep hygiene is again very important. And I've seen a lot of people who are admitted in the hospital and who are home quarantined who seem to appear to have a lot of sleep related issue. Now, at least 90% of the people that I spoke to in these past 2 years, I've noticed that a lot of people after COVID and during COVID are suffering from insomnia. Now, we don't really know if this is a direct consequence of COVID, or it could be because people are not, indulging in many activities. Because when you're going out, you're sort of exerting yourself mentally and physically. Perhaps that's not happening when you're quarantined or are in bed. So possibly that could be one of the reasons. We are not very certain about it, though. My next step would be to change the story that you tell yourself. Now, taking the previous example of Dr. DB, now Dr. DB was feeling this sense of guilt that he was not contributing much to anything, and felt worthless during his quarantine time. And like I mentioned before, it is perfectly normal to experience emotions like guilt and like sadness during the situation, but not to dwell on them endlessly, as they may become a larger issue. There are some things beyond our control, and there is only much we can do sometimes. This is a very, very difficult time for everyone, and engaging in compassionate self-talk is more important than ever. So talk to yourself like you would talk to a friend if they shared their problem. Be that friend to yourself. So every time Dr. DD was experiencing feelings of guilt and self-blame, he was asked to reframe his statements and engage in positive self-talk. So instead of saying, I'm a bad husband for not being around my wife when she needs me, instead telling himself that I'm doing the most loving thing right now by being quarantined at home. I am protecting my family and co-workers from COVID. So it's very important to change the story to yourself and treat yourself like you would treat a trusted friend. My next step is to, now we are heading towards a more sort of mindful approach to solving, to sort of dealing with stressors during COVID. Now, the next step would be to focus on your breath. Now, the way we think influences the way we breathe, you would notice. When we are anxious and panicking, we tend to breathe in a very fast and shallow manner. Whereas when we are relaxed, we tend to breathe in a very slow and controlled manner, you would notice. So the idea over here is that whenever you're faced with an overwhelming situation, bring your focus from your thought to your breath and let your breath control your mind rather than the other way around. Now, we are not aware of our breathing pattern most of the time. We tend to sort of, our mind tends to mostly influence the way we breathe. So it's very, very important to focus on your breathing pattern, to focus on the way you breathe. And like I said, whenever you're faced with an overwhelming situation, it helps to bring this focus from your mind to your breath. So bring your focus to your breath and try to breathe in a more relaxed and controlled manner. So by breathing slowly and by breathing in a controlled manner, your mind and your body will automatically go into this relaxed state. And one of the best ways of doing that is by following metronome breathing. Now, metronome breathing is very easy. It doesn't require you to sit in one place and breathe. You can do this whenever and wherever. You can do this while walking. You can do this while taking your online sessions. You could do this literally even while cooking and talking to people. The only thing that you need to do is to bring your attention to the way you breathe. And you need to inhale through your nose for 4 counts. Hold your breath for another 4 counts. And exhale through your mouth for 6 counts. While this exercise can't push away negative thoughts, it can't get rid of any negative emotions, it can certainly help relax and reduce tension from both your mind and your body, and can help you take more effective action. When you are in a more relaxed state of mind, you'll be able to take more effective actions to situations. And you'll be able to think in a more calm mind, from a more calm mind. So this certainly helps. It'll certainly even help people who are recovering from COVID, because if your mind and body is in a relaxed state, if your mind is in a relaxed state, automatically your recovery will also get better. Moving on. My last and my 10th tip would be to just accept. Accept that we are going through a pandemic. Denial of the pandemic does not actually solve the emotional problems that so many of us are facing. In order to solve those problems, we first need to acknowledge them. When we try to get rid of a negative emotion, when we try very hard to get rid of a negative emotion, we end up suffering twice. We already feel that emotion, and then we have the stress of getting rid of that emotion. Okay, I don't want to feel depressed. I don't want to feel anxious. Why do I feel this certain way? So trying very hard of getting rid of an emotion causes more pain and can be more detrimental and can lead you to suffer twice. Whereas if you feel a certain way and you just accept, okay, this is what I'm thinking, this is what I'm feeling, and I know this is going to pass. This is not permanent, this is only temporary. You'll only end up suffering once. Remember that all the emotions and feelings are temporary. There is no permanent state of mind. I understand you might feel depressed or you might feel low in a given situation. But in 1 hour, you might feel depressed. The second hour is something nice happens. You see something nice. You feel a little happy. You feel a little hopeful. So none of our emotions and feelings are permanent. They are only temporary. And it's very important to acknowledge that. And no emotion lasts forever when it's fully accepted and experienced. Acceptance of our emotions, our thoughts, and our struggles is a powerful way to cope during this pandemic. So we are coming towards the end of the session. Just to conclude, we spoke about 10 tips to cope with the stressors during the COVID-19 pandemic. First is to focus on what you can control. The second is having a routine. The third is setting small goals. The fourth is connecting with others, limiting news, focusing on more solution-focused manner, changing the story that you tell yourself, getting a good night's sleep, breathing, and accepting. So just to conclude, I would like to say that it is very important to remember, like I said in the last slide as well, that this is only temporary. Nothing is permanent in life. Things will go back to normal as they have after every pandemic over the past 3,000 years. I believe that there is always a lesson that we learn out of very, very difficult situation. Some people learn to cope with difficult emotions better. Some people are now taking their health more seriously. Some people are getting to spend more time with their family members. So it is very important to acknowledge and to recognize what you're learning from this situation and ask yourself, how are you going to apply this lesson moving forward from here? In closing, I would also like to say that coping isn't a one size fits all. These 10 tips may not work for you. So coping is all about figuring out what works best for you and apply that in your life. And remember that this is not a replacement for professional therapy. If you are experiencing any symptoms of depression or anxiety, please get yourself diagnosed and evaluated by a medical professional. In closing, I would like to leave you with the Serenity Prayer. Now, this is more relevant than ever, especially in these trying times. The prayer says, God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. The Serenity Prayer means letting go of situation beyond your control and taking action towards things within your control. It also means being able to know when things are within your control and when things are beyond your control. So with that, I conclude my talk. If you have any questions, please feel free to ask. Thank you very much for your time and attention. It was a pleasure being here and giving a talk. Thank you again.
Thank you, ma'am. Thank you for this wonderful session. And thank you everyone for joining us.
Thank you. It was an absolute pleasure to be here.
And if anyone has
if you need any help, if you have any questions, you can feel free to reach out to me. I'll be more than happy to help.
Yes. So do you mind if I put your email ID in the chat box? If anyone wants to.
Please.
Yeah.
Yes, sure. Please do that.
And while I do that, if anyone has any questions, please feel free to turn your mic on and talk to ma'am.
Yeah, so can I ask a question?
Yes, please.
Can I? Yeah. So actually, very nice. First, I must acknowledge and appreciate it was very nicely put all the points together. Thank you
Thanks,
so
ma'am.
much
Thank
for
you.
that.
Thank
So
you
my
so
question
much.
is that, like, thank you so much. And like in a family, if one member becomes so panicky about this, that
Hmm.
even the cloth touches the door and she will go and wash and take bath and will not
Hmm.
allow anyone to touch. And that is becoming so stressful for the family. So what
Right.
can be done?
So in this
Yeah.
approach, absolutely, and this is the point that even I was talking about when I spoke about focusing on what you can control. I think it would be very detrimental for somebody who has OCD, who goes a
Yeah,
little too
sort of
obsessive. You're
OCD.
absolutely right about that, and
Yeah.
that's a wonderful question. For patients like that, I follow a little bit of more mindful sort of approach, and like I mentioned in my talk, to accept some things that are not beyond your control. I mean, control things
Mhm.
to an extent, but don't get too obsessive about it. And then we sort of, make them, so we sort of, work with more mindful based approach where you ask them
Okay.
to control their impulses and accept, the current situation. And yeah, so basically, I think a more mindful approach would be the right thing to follow over
Mhm.
here.
Okay.
Like I said, different
Okay.
things work for different people, and I think
Yeah.
for everyone, different things work differently.
Different things will work. Yeah.
Yes,
So
absolutely.
what happened that she is the one I'm talking about is so stressful that she's not touching anything, doing anything, and then her husband has to do everything, and then consequently the husband is becoming stressful.
Right,
That's
right.
happening. Mhm.
I think this will also require proper psychiatric sort of evaluation as well.
Okay. Is
If
it
it's getting
okay?
very obsessive.
Fine. Fine. Okay.
Hmm.
Thank you so much.
No worries, no worries.
Thank you.
Thank you.
I would like to ask a question if you're okay.
Yeah, yeah, sure.
Yeah. Karishma, this is Pooja Sangvi.
Yeah, hi,
And
Pooja.
yeah, hi. So
Hmm.
as a counselor, I have been counseling a lot of clients, and I saw a lot of clients who two ways I have seen. One way where they have got COVID, and after
Okay.
their COVID is over, after their quarantine is over, they have been behaving very differently in their office settings and house settings in such a way that they now feel that again they will get COVID, again they will be quarantined, and all those stress. And the second
Right,
way is they are perfectly okay, but the relatives and friends have got COVID. So hearing
right.
them, they start feeling more stressed out at office, more slow at office. They have been in the office setting for so many years, but
Hmm.
they have suddenly started to feel that now I cannot handle a meeting. Now my confidence is going down. What will happen if I make a mess in the meeting? So all the doubts have started creeping in suddenly after working for so long in the office. So I have
Right,
been
right.
counseling them
So
and I
is
have been
it is
telling them
it is it
similar
after
things.
contracting COVID? I'm sorry to interrupt. Is it after
Yeah.
contracting COVID
So it is
or
both ways. After contracting COVID, they have been feeling more anxious in their normal routine. And
okay.
and the second set of clients I have seen is their relatives have got COVID and they have suddenly got anxious in their normal routine. So I
Right,
have been giving them tips just like you told us in the session. But
right,
if something more, if you would like to add, it would be a help.
right, right. So I think first I would really hear them out. I would follow a more supportive psychotherapeutic approach. So just hear them out and sort of point out the themes to them. And then sort of working towards, again, acceptance is very important over here. Accepting the situation like I mentioned before as well, and then sort of planning things ahead of time. I think, but again, this will require a proper psychiatric evaluation, and every case is a little different. So I think active listening is very important, helping them plan things ahead of time, sort of refraining from all the negative news that is there, and focusing on, focusing on more the positives and a more solution focused approach, I think would be the right thing. But I'm sorry, I didn't exactly get your question very well.
No, what you said is right. What you said is right.
Right.
And so my exact question was that one set of clients are after getting COVID, after they are out of the COVID and they are normal again, they
Right.
feel normally anxious in their daily routine life because of the fear कि दूसरी बार हो जाएगा. And the
Right.
second set of clients is they are perfectly okay, but because they have been hearing a lot about COVID in their family and friend circle, they have
Right.
started having lower confidence in their office setup, in their house routine, all those
Right.
things. So what you
Right.
told me, all of those I have been following, but and I also been doing hypnotherapy, relaxation with them. But
Yeah,
I
relaxation
would
makes a
like,
very big difference.
yeah, it really makes a very big difference, and they will
Absolutely.
also
And also, sort of incorporating that in the real life setting as well. Whenever they feel anxious, like I said, whenever you have this bout of anxiety, recognizing what you're feeling, recognizing your sort of accepting, and then asking yourself, what can I do about this situation, while not going too obsessive about it. I think some doing anything in excess is not recommended, while also explaining that to them.
Correct. Now, some of them
Hmm.
are also on psychiatric medication, so they
Right.
have been evaluated. But okay, yeah, thank you so much.
Okay. Okay, lovely.
Does anyone else have any questions or anything they want to share? Okay. So if not, I request Ms. Pooja to uh, kindly end the meeting with the closing comments. Hello, Pooja?
Can you hear me?
Yes.
Yeah. Okay. So I would really like to thank Dr. Karishma Jethmalani for a wonderful talk. The talk was really wonderful and insightful. You gave us a lot of insights, a lot of tips, how to manage during the COVID times and after COVID times. It was really helpful and insightful. Thank you so much for that. Thank you so much for your time. And I would
Thank you.
also like to thank all the participants for hearing Dr. Karishma and being a part of the talk. I have put my number in the chat box. Vatsal will also put the same. So we both are handling the team, handling the talks. So if any of you have been having any questions, any doubts, feel free to contact us. Thank you so much.
Thank you.
Thank
I'm
you.
sorry.
Thank you, everyone.
I think Jaswant Mehta ji has a question, if I'm not mistaken. I see your hand raised up, but I cannot hear you. So you need to turn your mic on. We cannot hear you, sir. I'm sending you a request asking you to unmute. Please tap yes on it.
Can you hear me?
Yes.
Can you hear me?
Yes, we can.
Karishma,
Yes, I can. Hi,
thank
sir.
you so
How are
much.
you?
Yeah, I'm fine, Karishma. Thank you so
Hmm.
much for the enlightened talk.
I'm so glad that
Rather,
you could attend.
rather than a question, there is something I would like to share,
All
Uh,
right.
Now, what I found, this COVID, staying at home allowed a lot of time for everybody. And what I did was, there were lots of things which I was not able to do it. Always wanted to take a longer walk. So COVID enabled me to take a longer walk. Maybe for 25 minutes, I increased it to 1 hour. That helped me a lot to lose my weight. I'm fitter now. Second thing, what I really learned in COVID was when I learned that steam inhalation is very effective, I shared that video among all my groups. Okay, taking steam inhalation is very effective. And then I found, the present model of steam analyzer is far better than what was earlier available. So I made it a point to distribute it to as many people as possible in my circle, in my staff, like missionaries in. Now that gave me so much of inner satisfaction. I distributed around 400 steam analyzer on my own. And the
Wow, that's very impressive.
feedback I started getting from everybody was so exciting that the whole stress of COVID, was totally forgotten. And, when last June, when it started, it itself gave me so much confidence that every day I was moving out. I'm running, I'm in the age of 80, but I moved every day outside for my work, for my site and everywhere. So there is something, I took it very positive because this is a challenge to be more compassionate for everybody. Now that relieved all the stress of COVID, so much. So this sometimes, how you use the opportunity. I always wanted this is an opportunity to help the people. So this is only the message I want to give, Any adversity also, if you utilize it, it brings more positive feelings, more positive reactions, and the response which you get from the people gives you more enthusiasm to tide over whatever negative stress you might be feeling. Just sharing the thoughts, that's all.
Yes, and absolutely. Thanks for your insights. That was very helpful. And you're doing everything that I actually mentioned in the talk, helping somebody through their problems gives you this sense of, meaning in your life. Having a routine, going for your walks, makes you look forward to something, having a routine. So this is exactly what you're doing. And taking care of your health, focusing on what you can control. So taking the steam inhalation, so you're doing everything in your power. And another important thing that you mentioned was to take this as an opportunity. To see the silver lining in the situation is very important. While
Correct.
in every difficult situation, there is always an opportunity. Even when you're depressed, when you're feeling anxious, even that can be used as an opportunity to understand yourself better. Right?
Yeah, I
Instead of
totally agree.
feeling low, telling yourself that, okay, I'm going to take as an opportunity. And this is, maybe I'm learning more about myself. Maybe I'm learning to deal with adversities better. Maybe this is making me a stronger person mentally. So
Correct.
I think you highlighted some of my main points
Right.
beautifully. And it's
Yeah.
very nice to see that you're implementing that in your life.
Yeah, in fact, all the steam analyzer I distributed even for the lower staff, like society watchmen, all my staff, they gave me a
Right,
lot of feedback. After taking steam inhalation, they feel a lot better. Everybody came and personally acknowledged it. So that gives
right.
you more positive vibrations. Okay.
Absolutely. I
Yeah.
totally agree with you.
Yeah. Right.
Yeah,
Yeah. Thank you
lovely.
so much
Thanks for
for
sharing your
enlightening talk.
insights. It was very helpful. You beautifully said it.
Right.
Lovely.
Thank you, sir. Thank you, ma'am. And thank you, everybody else. I think if there's nothing else, we should end today's session. Yeah. All right. Have a nice day, everyone. Hope you had a nice time. Goodbye.